Nitric oxide keeps all the cellular elements within our bloodstream flowing smoothly like Teflon rather than Velcro. It keeps things from getting sticky. Number two, nitric oxide is the strongest blood vessel dilator in the body. When you climb stairs, the arteries to your heart, the arteries to your legs, they widen, they dilate. That's nitric oxide. Number three, nitric oxide protects the wall of the artery from becoming thickened, stiff, or inflamed, and thus protects us from getting high blood pressure or hypertension. Number four, now here's the absolute key. A safe and adequate amount of nitric oxide will protect you from ever developing blockages or plaques. So literally, everybody on the planet, whether from Berlin, London, New York, Chicago, or India, if they have cardiovascular disease, it's because in all the preceding decades, they have now so successfully trashed, injured, and compromised the capacity of their endothelial cells to make nitric oxide. They simply haven't had enough to protect themselves from making blockages and plaque. However, the good news here is that this is not a malignancy. And once you can get people to stop ever again passing through their lips foods that are going to further destroy an already injured endothelium, then the endothelium begins to recover, makes enough nitric oxide so that the disease does not worsen. And exciting, we actually often see elements of disease reversal when that happens. So I think it's very important to understand what are the foods that every time they pass our lips, we injure the endothelial cells. They are any drop of oil, olive oil, corn oil, soybean oil, safflower oil, sunflower oil, coconut oil, palm oil, oil in a cracker, oil in a piece of bread, oil in a salad dressing. Oil injures endothelial cells, as does anything with a mother or a face. Meat, fish, chicken, fowl, turkey, and eggs, and dairy, milk, cream, butter, cheese, ice cream, yogurt, and any excess of sugary foods, sugary drinks, cakes, pies, cookies, stevia, agave, excesses of maple syrup, molasses, and honey.
True. You were one of the top surgeons in America. What made you change your approach to cardiovascular care? And can you shed some light on the early research that you did?
Well, the reason I got involved with this in the first place, it was when I was chairman in the late 1970s, when I was chairman of the breast cancer task force. It was so unsettling to me to think that for no matter how many women I was doing breast surgery, I was doing absolutely nothing for the next unsuspecting victim. And this led to a bit of global research on my part. And it was quite striking to see that there were cultures where breast cancer rates were 30 or 40 times less frequent than the United States, such as Kenya. And in rural Japan, in the 1950s, breast cancer was very infrequently identified. And yet, as soon as the Japanese women would migrate to the United States, by the second and third generation, still pure Japanese American, they now had the same rate of breast cancer as their Caucasian counterpart. And perhaps even more powerful was cancer of the prostate. In the entire nation of Japan in 1958, how many autopsy-proven deaths were there from cancer of the prostate? 18, the entire nation. By 1978, they were up to 137, which still pales in comparison to the 28,000 who will die in this country this year of cancer of the prostate. Well, somewhere along the line, I got the idea that there would be more bang for the buck if we could look at cardiovascular disease, the leading killer of women and men in Western civilization, because as part of this global review, I was encountering the fact that there were multiple cultures where cardiovascular disease is virtually non-existent. And it just seemed to me if we could get people to eat to save their heart, they would also begin to be saving themselves from the common Western cancers of breast, prostate, colon, and perhaps pancreatic.
True, true, true. You often say no more heart attacks and make yourself heart attack proof. Can you tell us what you mean by that?
Say that again.
You often say no more heart attacks and make yourself heart attack proof. Can you tell us what you mean by that?
Well, what I mean by that is usually I have slides that demonstrate this, but I'll try to explain it. I think that we're all experts would agree that 90% of heart attacks come when we have what we call a ruptured plaque. So that the cap over the plaque is ruptured. And now you have the extravasation or the oozing out of, if you will, of plaque content into the flowing blood in the artery. And that material, the plaque content is highly thrombogenic. It activates our clotting factor platelets, and often within minutes after the plaque ruptures, there will be the formation of an early clot or a thrombus, which is in and of itself self-propagating, so that in a further number of minutes, now that clot expands all the way across and the entire artery is suddenly shut. It is now totally blocked, and all the downstream heart muscle is now deprived of oxygen and nutrients. It starts to die, and that's the heart attack. Now, in other words, to be heart attack proof, remember, a significant part of that cap over the plaque ruptures because of all this progressive inflammation. And therefore, if you are consuming nothing that is going to increase inflammation, that is getting rid of the Western foods that we mentioned, and at the same time, you are consuming foods that will strengthen the endothelium, then the cap over the plaque cannot rupture. If the cap over the plaque cannot rupture and you strengthen it, you have made yourself heart attack proof.
True. True. That's good. In your opinion, at what stage a plant-based diet can play a role in management of heart disease? And if I may add to that, what do you think about the preventive use of stents and bypass surgery?
Well, you'll have to ask me the second part again, because maybe I will have forgotten it. So start. Okay. Yeah. What was the first part?
At what stage a plant-based diet can play a role in the management of heart disease?
All right. At what stage? Well, obviously at any stage. If you have somebody who's had 5 heart attacks, they can obviously be helped. If they've had 3 heart attacks, they can be helped. If they have a lot of chest pain, but they've never yet had their heart attack, they can be helped. And if they never want to even start to have the chest pain, if they never want to have the disease in the first place, they can be helped. They can be prevented. It can be avoided.
That's great.
All by eating whole food, plant-based nutrition. And most importantly, do not eat the foods that are going to injure the endothelial lining and suppress the manufacture of nitric oxide. Now, what do you think of stents and bypasses? Look, there's no question, and I think there's agreement, that when somebody is in the middle of having a heart attack, a stent or a bypass can be absolutely life-saving. However, when somebody is not in the middle of a heart attack, when they're stable, the idea of trying to add a stent or a bypass, there is very, very little hard scientific data to show that there will be prolongation of life or protection from a future heart attack in that setting. Because when you think about it, the plaques that cause a heart attack are usually the smaller ones that are filled with inflammation. They're blocking the artery by no more than 10, 20, 30, 40, or 50%. And those are the ones that you never would treat with a stent. Anyway, you limit most of the ones that are, let's just say that to qualify for a stent, you'd like to have something that is at least 70% or greater blocked. But then those aren't the ones, those aren't the ones that seem to rupture. So really, when you think about it, somebody is treating aggressively the plaques that are not going to cause a heart attack. Yes, they can cause some symptoms, but it seems to be a lot safer, a lot simpler. If you simply change the diet, you treat the causation of the illness. This is the thing that's so frustrating about the way present cardiology is practiced. Because ever since the days of Hippocrates, there has been a basic covenant of trust that wherever possible, the caregiver will share with the patient what is the causation of the illness. And sadly today, in most cardiovascular care situations, patients are not being informed about what has caused their illness. And really that's unfortunate. And it's not done without any malice of forethought. It's just that right now the cardiovascular community, never in medical school and never in their postgraduate training, has had sufficient understanding and training about the value of nutrition that can absolutely halt the disease that they're being asked to care for.
True. You almost answered my next question, but can you explain a bit more about the process of natural bypass and opening up of the collateral arteries?
Well, often what seems to happen is when a patient has had some progressive angina, and they'll see the cardiologist, and they will first they'll fail their stress test. After they have failed their stress test, they will be asked to have an angiogram, a catheterization with an angiogram, and that angiogram is then going to try to demonstrate what the degree of blockage is. Okay. What was the rest of the question?
About the natural bypass, the nitric oxide,
All right.
how it opens up the collateral arteries.
Let's suppose that this person has the angiogram, and they'll find out that the right coronary artery, somewhere in its proximal portion, is 100% blocked, but there's been no heart attack. Because as you look at the 100% block, you will see streaming around the side, there will be multiple little vessels we call collaterals. Now, there'll never be enough flow going through those collaterals to equal the normal flow. But the flow through those collaterals is enough to sustain the downstream heart muscle. Even when that artery is 100% blocked, that downstream heart muscle can still maintain its viability because there is sufficient oxygen and nutrients going through these small collaterals. And those patients don't have to have the bypass, and they don't have to have stents. They can, if they aggressively make the changes and start to treat the causation of their illness. Now, it's not going to open up an artery that is 100% blocked, but often you can get shrinkage of the blockage in patients who have a plaque that is sort of a young plaque that is soft and made up of inflammation, fat, and cholesterol. And those often will respond. Now, the older plaque that has been there for decades, that is made up of scar and fibrosis and calcification, really may not change much at all. But at the same time, interestingly enough, those patients can also enjoy remarkable improvement and often return to full activities without restriction, even though that epicardial plaque may not regress much, because what's happening is this. If you get, and there are some lovely slides available which show a picture of the heart without any muscle. And what you see is you see those three major vessels, the right coronary artery, the left anterior descending, and the circumflex. Those are the epicardial arteries where all the discussion about plaques and bypasses goes on. However, if you look further at where those vessels go, you'll see they dive into the heart muscle. They are all intertwined, interconnected, collateralizing each other. And when these patients are initially seen by us and they're having their symptoms, believe it or not, when the endothelial cell in those patients has been so injured, so compromised, the endothelial cell is no longer your friend. And it is now no longer making much of any nitric oxide, the great vessel dilator, but the endothelium now is making two vasoconstrictors, endothelin and thromboxane. So that entire enormous cascade of vessels that are intramuscular, which never have plaque of the ordinary type, all that cascade is vasoconstricted because of the thromboxane and endothelin. Once patients eat in a way to restore the endothelium, it stops making the vasoconstrictor. It starts making nitric oxide again in full amount, the vasodilator. So the entire intramuscular cascade opens up. And if you recall in physics, Poiseuille's law of flow through the hollow viscous is related to the fourth power of the radius. That tiny increase in diameter through all those thousands of interconnecting vessels, there's a huge increase in flow.
True, true. That's a great, you should say, a miracle of the plant-based diet. Do you think that a plant-based diet can not only extend a person's life, but also enhance their quality of life? And can a plant-based diet fully prevent and reverse heart disease?
Well, I think I've just answered that question. Obviously, it can extend the life. If you're not having a heart attack, you're going to have your life extended. If you already have heart disease, then you're not going to have further complications. You're going to have your life extended. And I don't think that there's what was the latter part of the question?
Can it fully prevent and reverse heart disease?
Yeah, well, no, it's not fair to say it fully, because I mentioned that if the plaque in the epicardial artery is an old plaque that is made up of scar and fibrosis and calcification, the likelihood of that significant being reduced is really rather remote. But I explained how even those patients can enjoy a return to regular daily activity without restriction when they do this properly.
Okay. What is the role of genes? Many people feel that if they are genetically predisposed to getting diabetes or cancer or heart disease, there is nothing anybody can do about it. What are your thoughts about it?
You know, that's really, there's no question that there will be some families where it will appear, for example, none of the males will have lived over 55 or 60, but if you look at it, they're all eating the Western diet, right?
Yeah.
In other words, we have a saying, genes loads the gun, but lifestyle pulls the trigger. Let me give you an example of genes. Let's suppose you've got a village, and the village is next to a river. Now, during the flood season, it is only the very strongest swimmers that can safely make it across. However, if we wait to the dry season, when the river is 3 inches deep, Even the littlest toddler can go across safely. Everybody can make it safely. That's the way it is in avoiding heart disease. If everybody like Okinawa, everybody like Central Africa is not eating any foods that is going to injure it, this is what we call epigenetics. You change you modify genetic expression.
Yeah.
You turn off the bad genes, you turn on the good genes.
True. That's amazing. Not many people would agree or would know that gene.
No. I think yes, there certainly is agreement that there are families that are more prone to this, but even those people can be protected if they're eating properly.
Yeah, I know. Coming from you, I'm sure people will start believing in this now.
Well, we've done the research.
Exactly. Yeah. The next question: why don't most doctors recommend diet and lifestyle changes as the first line of treatment for heart disease?
For years, I have resisted saying this. There are enormous financial rewards in, but I think the most important thing of all, most physicians are conscientious and caring and passionate about the health of their patients. And presently, the community of physicians who cares for cardiovascular disease have absolutely no training in the causation of their illness. They don't talk about nutrition. They've never learned about it in medical school. They've never learned about it in their postgraduate days. All they can do is give them pills and drugs for symptoms or offer them procedures which have high morbidity, high mortality of stents and bypasses. And they never talk to them about nutrition. It's right now, it's almost getting to the point where it's sort of disgraceful, because we have patients that have been treated at the very, very best clinics in the planet. They fail. They come to us, they blossom.
That is the power of plant-based diet.
Yeah.
What would you what would be your advice to cardiologists about a plant-based diet being a scientifically proven method of preventing and reversing heart disease?
Well, I think the best way to answer that is to share that just 2 years ago, I was asked to join the American College of Cardiology Nutrition Committee, which I have done, along with Dr. Dean Ornish, Dr. Robert Osfeld, Dr. Kim Williams, who was formerly president of the American College of Cardiology, Dr. Neil Barnard, Dr. Monica Agarwal, and others who are totally convinced, and Dr. Andrew Freeman, who is the chairman of the committee. These are conscientious physicians who totally understand the value of plant-based nutrition. And we are trying to have the cardiologists grasp and understand the power of this. As a matter of fact, just several weeks ago, down in Orlando, Florida, at the annual meeting of the American College of Cardiology, there was a panel of those of us on the nutrition committee who presented to a fairly large room about the value of plant-based nutrition. And I must say, their questions were wonderful. The room was filled to standing room only. And it was very exciting to see some of these younger cardiologists now developing and understanding and caring about the power of nutrition. And I think slowly we're beginning to turn this around.
Great to hear. So if someone would come to you with heart disease or some kind of a problem, what would be your simple prescription to him or her?
if this is somebody who already has had a stent
Yeah.
or a bypass, or
Okay.
they have
Okay. Let's talk
chest
about
pain,
that.
or
Yes. Yes.
they
Let's
have
talk.
failed,
Let's
they
talk about.
failed their, they have failed their stress test.
Yes. Yes. Could we talk about them?
Yeah. Well, if they're not an emergency, I would get them to aggressively make these types of lifestyle changes. Now, it's particularly gratifying when you start out with somebody, let's say, who has not had a heart attack, but they have stable angina. And what is so exciting and gratifying is that those people who absolutely assiduously follow this program, literally within days, they'll notice they can walk farther before they begin to get chest pressure, or they can go up the hill a little bit faster than they could before they get chest pain. And then they suddenly realize that they themselves have now been empowered as the locus of control to halt and reverse this disease that is trying to take them out. And that, I think, is very, very exciting, not only for the patient, but it's also very exciting for the physician.
True. Very true. Dr. Esselstyn, we follow most of the recommendations we have given here today when we treat our patients at our facility Prakritika in Hyderabad, India, where we offer individual, group, and residential programs to prevent and reverse diabetes, heart disease, and obesity and other lifestyle disorders, mainly through a whole food plant-based diet and other natural therapies. We've seen some very good results here. And it's really encouraging to know that a lot of people are coming forward to use diet and lifestyle changes to cure lifestyle disorders. So it's very heartening. In India also, people are trying to follow the plant-based diet methods. And I'm sure after listening to this interview and going through your books, I'll put a description down in the where you can buy this book. Thank you very much, Dr. Esselstyn, for your time and patiently listening to all my questions. I'd learned a lot from you as a student and graduate at Cornell's plant-based nutrition certification program. It has been an honor talking to you today. Thank you and take care.
Thank you, and thank you. All the very best. I was in India myself. And I think it was in 2000 when I was at Pondicherry and Hyderabad and Mumbai and Calcutta and New Delhi.
Okay.
I gave talks all over there, and it just seemed to me that India was in a horrible epidemic of cardiovascular disease.
Yes, yes.
And they're eating ghee, they're eating meat, they're eating oil, all these things that could just absolutely give disease. And so good luck. You got a lot of people there. You're going to have to try to help. Yeah, but remember, the answer to this disease is not going to be stents and bypasses. The answer to this disease is really going to be lifestyle change and empowering these patients themselves to be the locus of control. And actually, there's something about the Indian anatomy that makes it, I think, a little bit more prone to succumb to the Western diet.
True. Yeah, true. A lot of McDonald's, a lot of KFCs, and a lot of other people coming in.
Yeah. Good luck, and thank you so much. What a privilege.
Thank you. Thank you. Nice talking to you.
Yeah. Bye-bye.
Bye.